in this day and age, there's been so much emphasis, at least in the cataract surgery world, placed on the intraoperative technologies with femtosecond lasers and intraoperative aberrometry and all of this great technology that we have intraoperatively. But for most practices, we have to go back to the basics. And refractive cataract surgery and the refractive elements of refractive cataract surgery really begin preoperatively with the preoperative biometry. And so we're only going to be as good as our preoperative data and our preoperative biometry can be. And that's really where the Zemer technology, particularly the Galilei, has fit into our refractive suite to provide us really accurate biometry and to do so with efficiency. In terms of the Galilei and in terms of efficiency, the Galilei's technology, in particular the graphic user interface, was very simple, very clean. It was a very smooth learning curve. I sort of compare it, sort of jokingly, between an MS-DOS system that some topographers and technologies have versus a nice, clean, Apple-based OS system. It's very clean, it's very user-friendly, it's very intuitive. And to be able to have things like an image quality system, so that when you see a green check mark and a 98% quality rating, the technician knows that they've produced a good quality image and a good quality data point, or a set of data points, so that by the time the patient's getting to me for their consultation, I know I can rely on that data because the quality of that image is good. Whereas it serves as a self-check for that technician to repeat the image if they see a poor quality image. What's beautiful about that Galilei is that with the dual shine flute cameras, it makes it fast. Angulation of the patient's head is less of an issue. And you then combine the placido disc imaging on top of that, and it's giving you anterior and posterior corneal astigmatism readings. For post-refractive patients, it's giving us great data. All of this comes into play, and being able to trust that preoperative data really means a whole lot intraoperatively and in terms of our post-operative outcomes. We have a relationship in our practice with some of the key folks at Zemer, and so we've worked with them before in integrating other types of technologies to our practice. Integrating it, the Galilei was just one further step in that direction. What was nice is that we were not just buying a device, we were not just buying a box and then saying, here, go on your own and have at it. We were buying a partnership, and certainly Zemer has become a silent partner in our practice and supported us with their engineers and specialists to make sure that we're integrating it and utilizing all of the technologies that were available. Zemer was really good about saying, here's how you can use this data. It is a lot of data, which is great, but here's how to use it, and here's where the rubber meets the road in terms of getting better outcomes for you. So they're very helpful in turning us in the right direction and pointing out how to utilize the technology to its best purpose. Refractive cataract surgery really begins far before surgery itself. And in terms of achieving best patient outcomes, we've known historically that unlike LASIK outcomes, where we're within our plus or minus a quarter diopter 99.9% of the time of our refractive target, with cataract surgery, we're not meeting the same standards. Surgeons who actually measure their outcomes are realizing that we may be between 60 to 80% or 87% on average, plus or minus a half diopter of refractive target. So much of those outcomes is based on having accurate preoperative biometry that accounts for anterior and posterior corneal astigmatism, that accounts for oblique astigmatism, that can give us measures of irregular astigmatism, an assessment of what the ocular surface really looks like. This is going to impact our lens power choices for sure. It's going to impact what kind of recommendations we make for a patient. It's going to help me immediately recognize that this patient might need a toric lens versus this patient might benefit from a multifocal lens, or this patient might be a horrible candidate for a multifocal lens. All of that within a few seconds, it's allowing me to make those decisions and make a very clear recommendation to my patient. And then it gives me the confidence to produce a good outcome on the back end. I think the Galilei really fits the bill. It's one device that's going to impact all of your refractive surgery outcomes and screenings for LASIK, PRK, what have you. It's going to allow you to screen patients for inlays if you're that advanced, and it's going to affect your cataract surgery outcomes and refractive cataract surgery outcomes. It's giving us a complete picture of a patient's optical system, in a sense, and it's impacting every level of my patient counseling, lens recommendations, how we do the surgery. It's impacting outcomes. And so it really has a very comprehensive effect on our entire practice. The ease of use, the efficiency of it all, the precision and the accuracy that the software and just the design itself has. I'm excited to look forward to the next generation Galilei that will be even more comprehensive, because now we'll be able to have sort of one-stop shopping for refractive cataract surgery, being able to integrate IOL calculations and axial length measurements with a topography and a tomographer, all in one device.